Welcome back now for Should I Worry, our weekly segment about, everything that worries us. This viewer asks, I had LASIK eye surgery several years ago, but I'm noticing that my vision is getting worse. I'm using drugstore reading glasses to help with work on the computer, but how do you know when to switch to an actual prescription? All right, Dr. Samadi, I had LASIK surgery, and the doctor warned me ahead of time, it's going to give you 20/20 distance, but eventually you're going to have to use reading glasses. The LASIK can't do anything about it.
Yeah, I think if you put the question back up again, what's concerned me about this particular person is he or she was doing well, and over time the vision is kind of precipitating and they're not doing so well. In that particular case, you should absolutely see your ophthalmologist. I have no problem with people like using some of these drugstore glasses, sunglasses.
Right.
They're very inexpensive. You can buy a lot of them and have them, and if you lose them, no big deal. But having a baseline visit to ophthalmologist and know what your eye vision is exactly, if there's no glaucoma or cataract, we talked about it last week, or macular degenerations. As we get older, the flexibility of the lens would start to go down. That's part of the aging. And starting at the age of 40, and unfortunately even 6 months ago, I started wearing one of these.
Right.
It's a natural part of life.
Right, can't do anything about it.
With LASIK, you should do well. But the point of this segment is that if you buy one of these drugstore, you may have, both eyes may not be exactly the same kind of degree of acuity, and having a doctor that will look at it. The other thing is unlike presbyopia, which is the near vision, if you have a distant problem,
right,
your doctor needs to do it, and a lot of these drugstore glasses are not going to be able to do it. So once a year or once every 18 months, I think it's a great place to go and visit your doctor.
What do you say, Dr. Siegel?
LASIK is performed on 11 million people right now. What is it? It's the cornea, the outer covering of the eye, and nearsightedness, as David was saying, it gets like a cone. So the LASIK is a laser, and it flattens it out. And as they told you, Greg, it's supposed to last. The distance vision is supposed to last forever like that, and it does in 95% of the cases. The problem is that you get farsighted. And you know what, viewer? You should not go in to a drugstore and buy a pair of glasses, because how do we know you don't have another problem? We don't know if it's glaucoma. We don't know if it's macular degeneration. We don't know what it is. Your ophthalmologist has got to examine anybody who has a change in vision. So then you can decide you need reading glasses. But it's got to come from an eye doctor, not from a drugstore.
I think going back to what Mark was saying, which is a very important point, is that you may actually, this person may have some underlying glaucoma, which is increasing the pressure in the eye. And if you don't see the doctor, it may be too late, and you can actually lose your vision. So it's okay to use some of these glasses if you're just having fun and you already have seen the doctor, you want to save some money. But don't go automatically and self-prescribe yourself and start using, especially if there's a change in your vision.
Absolutely.
That was the key in that question.
And the question also asked, he had LASIK surgery, but now he's having trouble seeing. Is that normal? Can you go back and get it redone?
You can get it redone, but most of the time they're going to redo it because you become farsighted. They can do it both ways. LASIK can either make you less nearsighted or it can make you less farsighted. So if you're having trouble reading, they could fix one eye and that would be your reading eye. Most of the time we can do it with glasses, and I'm not against the drugstore glasses. I just don't want that to be the first stop. That could be the last stop.
It's just a lens in your eye, just like the camera, the way you focus it, it loses its flexibility, and that's how they can adjust it.